So, good evening everyone. I am Crystal May Baclion, a student nurse from Leopold'S College. So today I'm going to perform the Leopold'S maneuver. So before we proceed to the assessment, first I'm going to provide privacy to my patient. So we'll close the door and close the curtain. So next, I will present the equipment needed for the assessment. So what we need is the stethoscope, a pillow and a blanket for extra comfort for the patient, and also for the alcohol for hand hygiene. So I will put this first. So now I'm going to introduce myself to the patient. So good day, ma'am. I am Crystal May Baclion, student nurse from Leopold'S College, BSN 2, 12K. So may I know what's your name?
Nice to show our Sanchez.
And what's your birthday?
July 27.
Okay, thank you. So what do you want me to call for?
Ma'am.
Ma'am, okay, thank you, ma'am. So now that I have already introduced myself to the patient, I will ask the patient again to empty her bladder. So ma'am, would you like to empty your bladder first before we proceed to the assessment? Thank you. So the purpose of emptying the bladder of the patient is to reduce the risk of pressing the bladder of the patient. So ma'am, are you okay now? Are you comfortable now? Okay, thank you. So after the patient have already emptied her bladder, now I'm going to assist my patient into a supine position. So please, lie down. Okay. So using the blanket, I will cover up my patient. Okay. So now I'm going to assess the abdomen of the patient. So I'm going to show the abdomen of my patient. So ma'am, I will pull up this one. Expose your abdomen, and would you like to open your thank you. So only to expose the abdomen part of the patient. So now, after that, I'm going to assess first the uterine fundus of the patient. This is to locate the head of the fetus. So I'm going. And before we put our hands, make sure to warm up your hands so that the patient won't feel uncomfortable. So I'm going to assess now, ma'am, and palpate. Okay. So as you can see, I am pressing my hand into the uterus fundus of the patient. This is to check if the position of the fetus is in this position, and if you feel something round with it, and that's the head of the fetus. Thank you. So next, I will be assessing is the sides of the abdomen of my patient. So this is to palpate the extremities and the fetal back of the fetus. So I'm going to assess the ma'am. Okay. If you feel a slight something numble in the patient's sides, and that is the extremities of the fetus. And if you palpate also, if there is something that is continuous, continuous feeling of the side of the abdomen, and that is the back of the fetus. Thank you. So now I'm going to assess the symphysis pubis of the patient. So I'm going to touch it now. So this is to palpate or locate if the position of the fetus is engaged or floating. Okay. So next is to I'm going to the side of the patient to face to the feet of my patient. So next I'm going to assess again here in the symphysis pubis to also feel the position of the fetus. So last is to locate the fetal heart tone of the fetus. So we will be using the stethoscope to feel and to feel the fetus heart tone. So we'll palpate first. Okay. So here's the the fetal back of the fetus. You will wait for 1 minute to find the fetal heart tone. Okay. Now I've already got the fetal heart tone. Now I'm going to note the findings of the patient. Okay, so I'm going to unexpose your abdomen. Okay. So now I'm going to dictate the findings of your the result. I mean, for your assessment. So the FHR is the fetal heart rate is at 120 BPM. The location of the fetal back is in RLQ, and the fetal presentation is at the is in cephalic position, and then the position ROA is at right occiput anterior. So the attitude of it is at vertex, and the fetus is floating. The fetal lie is longitudinal lie. So that's it for your findings. Thank you for your cooperation. So next I'll be doing is to do the hand hygiene. And then to position to the sitting position of the patient. So that's it for the Leopold's maneuver.